Hi, everyone. I'm here and going to share my screen for the literature review presentation. And mine is on the effect of external female urinary catheters on catheter-associated urinary tract infections, also known as CAUTIs. First, let me say that indwelling urinary catheters account for approximately 75% of hospital-acquired urinary tract infections, according to the CDC, which means that there's a critical need for us to explore the PICO question in incontinent female patients. Do female external urinary catheters compared to indwelling urinary catheters reduce CAUTI rates over a 3-month time period? As we all know, indwelling urinary catheters have that associated risk with infection. This can lead to sepsis and ultimately death. For my literature search, I used Penn State University libraries and utilized the PubMed website as well as National Institute of Health. My key search terms were female external urinary catheter, PureWick, indwelling urinary catheter, and CAUTI. My article synthesis was on for this presentation on the 5 articles listed here to the left. I'll talk about similarities in strengths, weaknesses, design format, and data analysis, and what studies differentiate from others in those aspects. So overall strengths included sample sizes, which were very large and led to our inferential statistics. Another strength was the duration period of these studies from 6 months to 2 years, which lent more strong data to our p-values, which in our data analysis indicate that the female external urinary catheters do reduce CAUTI rates. Metrics that were used throughout these articles include patient days, ICU days, and CAUTI incidences. There was only one article that did not utilize these metrics, and therefore the article was weaker in its data analysis. Other weaknesses that were common themes were that all these articles, except for one, were conducted in ICU units. Therefore, the data could not be applied to all populations, such as medical surgical units or emergency department units. However, these articles are strong in ICU units and tertiary units. The design and format for all the articles were quantitative retrospective studies. Therefore, it gave pre-implementation CAUTI rates to compare to post-implementation CAUTI rates with female external urinary catheter implementation. The design focused mostly on females, but there were 2 articles that included males as well, which that data was separated from our female data and could be utilized for this research synthesis, article synthesis. Overall, it was a level 3 research design, and you couldn't do any level 2 or 1 because if you had to place a catheter in a healthy person using randomization, you wouldn't want to introduce that risk of infection. So overall, our recommendations include timely removal of indwelling urinary catheters and replacement with female external urinary catheters, such as the PureWick in this picture, which could function for intake and output monitoring while reducing the risk for CAUTI rates. This also increases patient comfort, therefore leading to less infection, less time in the hospital, and lower costs on patient and facility sides. In conclusion, you'll want to lose the tube as the picture states, because the female external urinary catheters will reduce the rate of CAUTIs through the timely removal of indwelling urinary catheters. Quantitative retrospective studies are the majority of the research articles used to analyze female external urinary catheter data. large sample sizes and time periods from 6 months to 2 years are adequate for the inferential data to apply to populations. However, the focus was mainly on, like I said, those ICU settings, leaving a large portion of the population underrepresented. However, I feel that these articles are strong evidence, as seen by their article critique and synthesis that I did, to apply these female external urinary catheters in ICU settings. Thank you, everyone, and I hope you have a good time and a good break until next semester. Good luck with finals.